Pediatrics Pharmacology Exam Quiz. Question 1. In Pediatrics Pharmacology, a question focuses on weight-based medication dosing. Which nursing action is the safest first priority? Option A. Verify weight, dose range, allergies, route, concentration, timing, and response. Option B. Finish routine documentation before assessing the child. Option C. Delay action until all family members arrive. Option D. Focus only on comfort and ignore physiologic risk. The correct answer is option A. Verify weight, dose range, allergies, route, concentration, timing, and response. Because weight-based medication dosing can become dangerous when early clues are missed, the nurse begins with verify weight, dose range, allergies, route, concentration, timing, and response. Pediatric judgment works like a lighthouse in fog, guiding the nurse toward life, safety, and rapid reassessment. Question 2. A nursing student is reviewing safe dose range calculation. Which finding should be treated as most urgent? Option A. A stable child asking for a warmer blanket. Option B. Wrong weight, wrong concentration, allergy history, respiratory depression, abnormal heart rate, or dose outside safe range. Option C. A caregiver asking about meal timing. Option D. A calm child with no change from baseline. The correct answer is option B. Wrong weight, wrong concentration, allergy history, respiratory depression, abnormal heart rate, or dose outside safe range. Because urgent findings threaten oxygenation, circulation, neurologic status, or organ function, the nurse responds before the problem grows teeth. In pediatric care, the early warning sign is often the secret that prevents a crisis. Question 3. Which response best shows clinical judgment when caring for a child with acetaminophen safety? Option A. Rely on one normal value and stop monitoring. Option B. Use the same plan for every child without reassessment. Option C. Compare current findings with baseline trends and escalate meaningful changes. Option D. Avoid asking the provider questions. The correct answer is option C. Compare current findings with baseline trends and escalate meaningful changes. Because children are moving stories rather than frozen pictures, trends reveal direction and speed. The nurse who compares, questions, and escalates is protecting the child's future. Question 4. Which nursing action should be avoided during ibuprofen teaching care? Option A. Rechecking vital signs after an intervention. Option B. Communicating a sudden change during handoff. Option C. Teaching the caregiver what danger signs to report. Option D. Ignoring new symptoms because the child looked stable earlier. The correct answer is option D. Ignoring new symptoms because the child looked stable earlier. Because earlier stability does not guarantee current safety, ignoring new symptoms is like using yesterday's weather to drive through today's storm. Pediatric nursing demands fresh assessment for fresh decisions. Question 5. Which caregiver teaching point is most important for antibiotic administration? Option A. Explain warning signs, medication safety, follow-up care, and when to seek urgent help. Option B. Tell the caregiver to stop care once symptoms improve. Option C. Encourage sharing prescriptions between children. Option D. Tell the caregiver that follow-up is never necessary. The correct answer is option A. Explain warning signs, medication safety, follow-up care, and when to seek urgent help. Because discharge is not the end of nursing care, teaching gives the family a map for the road home. Good education turns fear into a plan and prevents avoidable returns. Question 6. Which outcome best shows improvement in allergy assessment? Option A. A more attractive room setup. Option B. Stable vital signs, improving symptoms, safer trends, and better age-appropriate function. Option C. More toys at the bedside. Option D. The child asking fewer questions. The correct answer is option B. Stable vital signs, improving symptoms, safer trends, and better age-appropriate function. Because true improvement appears in the body's evidence, the nurse looks for safer trends instead of surface comfort. Recovery leaves footprints in vital signs, behavior, symptoms, and function. Question 7. A nurse is creating a care plan for digoxin in children. Which goal is most appropriate? Option A. Complete paperwork before any assessment. Option B. Avoid involving caregivers in care decisions. Option C. Prevent complications while supporting recovery through focused assessment and timely intervention. Option D. Wait until severe symptoms appear before acting. The correct answer is option C. Prevent complications while supporting recovery through focused assessment and timely intervention. Because pediatric care rewards prevention, the nurse builds a plan that sees danger early and acts before damage spreads. The best care plan is a shield, not a reaction after the wound. Question 8. Which handoff detail matters most for insulin administration? Option A. The child's favorite cartoon only. Option B. The caregiver's parking location. Option C. The color of the child's socks. Option D. Recent changes, current risks, interventions performed in child response. The correct answer is option D. Recent changes, current risks, interventions performed in child response. Because handoff is where patient safety can either travel or disappear, the nurse shares what changes the next decision. Clear report keeps the child protected when one caregiver passes the torch. Question 9. Which action best prevents errors during inhaled bronchodilators care? Option A. Verify orders, weight-based dosing, contraindications, response, and concerns. Option B. Assume every order is safe without checking. Option C. Skip reassessment after medication administration. Option D. Document a response that was not assessed. The correct answer is option A. Verify orders, weight-based dosing, contraindications, response, and concerns. Because pediatric safety is built from verification and follow-through, the nurse treats each intervention as a promise that must be checked. Accuracy is not slow, it is how speed stays safe. Question 10. Which caregiver statement shows a need for more teaching about corticosteroid therapy? Option A. I will ask for help if symptoms suddenly worsen. Option B. I will wait several days before reporting serious warning signs. Option C. I will give medicines exactly as explained. Option D. I will keep follow-up appointments. The correct answer is option B. I will wait several days before reporting serious warning signs. Because waiting can turn a manageable pediatric problem into an emergency, the nurse corrects any belief that delays help. The most valuable teaching is the sentence that makes the family act in time. Question 11. For antiepileptic medication, which assessment should the nurse prioritize? Option A. Only the child's preferred snack. Option B. Only the room temperature. Option C. Focused assessment of the body system at risk plus vital signs and mental status. Option D. Only the time of the last visitor. The correct answer is option C. Focused assessment of the body system at risk plus vital signs and mental status. Because focused assessment reveals whether the threatened system is holding or failing, the nurse gathers data that can change care. Assessment is the radar that sees danger before it reaches the bedside. Question 12. Which complication should the nurse watch for with opioid safety? Option A. Temporary boredom during hospitalization. Option B. A harmless preference for a different pillow. Option C. Routine dislike of hospital food. Option D. Deterioration involving breathing, perfusion, infection, hydration, bleeding, or neurologic status. The correct answer is option D. Deterioration involving breathing, perfusion, infection, hydration, bleeding, or neurologic status. Because pediatric complications can spread from one system to another quickly, the nurse watches for the pattern that threatens survival. Catching the first falling domino can save the whole line. Question 13. Which delegated task is safest for an assistive team member during sedation monitoring care? Option A. Collect routine vital signs and report abnormal findings immediately. Option B. Interpret unstable assessment changes independently. Option C. Change high-risk medication doses. Option D. Decide whether rapid response is needed. The correct answer is option A. Collect routine vital signs and report abnormal findings immediately. Because delegation should extend the nurse's reach without handing away clinical judgment, routine data collection is appropriate when reporting rules are clear. Teamwork works best when everyone knows the danger line. Question 14. A child with immunization reactions suddenly seems confused. What should the nurse do first? Option A. Assume confusion is normal and leave the room. Option B. Assess oxygenation, perfusion, glucose risk, medication effects, and neurologic status. Option C. Wait until the next shift to reassess. Option D. Offer entertainment before checking safety. The correct answer is option B. Assess oxygenation, perfusion, glucose risk, medication effects, and neurologic status. Because new confusion can be the brain reporting poor oxygen, low perfusion, infection, or metabolic trouble, the nurse treats it as a clinical alarm. The mind often speaks for the body before the body collapses. Question 15. Which documentation is strongest for oral medication administration? Option A. A vague note saying the child seemed fine. Option B. Only personal opinion without data. Option C. Objective findings, time of intervention, child response, caregiver teaching, and notifications. Option D. A copied note from a different patient. The correct answer is option C. Objective findings, time of intervention, child response, caregiver teaching, and notifications. Because documentation is the memory of care, it must show what happened and how the child responded. Strong charting protects continuity, accountability, and the next safe decision. Question 16. Which question best tests caregiver understanding after teaching about medication safety? Option A. What color was the hospital wall? Option B. Which nurse entered the room first? Option C. What meal did another patient receive? Option D. What symptoms would make you seek urgent help after discharge? The correct answer is option D. What symptoms would make you seek urgent help after discharge? Because teachback reveals whether information became usable action, the nurse asks the caregiver to explain warning signs. Understanding is proven when the family can carry the plan outside the hospital. Question 17. Which action best supports safe medication use and medication reconciliation? Option A. Check weight, indication, allergies, labs, route, concentration, and response. Option B. Give medication first and ask questions later. Option C. Ignore lab values before high-risk medication. Option D. Use another child's medication if the drug name matches. The correct answer is option A. Check weight, indication, allergies, labs, route, concentration, and response. Because pediatric medication can heal or harm depending on weight and current condition, the nurse connects the order to real-time evidence. Safe medication practice is clinical reasoning in motion. Question 18. A caregiver asks why repeated assessments are needed for high-alert medications. What is the best explanation? Option A. Repeated checks are only for paperwork. Option B. Your child's condition can change, so repeated checks show whether treatment is working. Option C. The team does not trust the caregiver. Option D. Assessments are done only because the room is available. The correct answer is option B. Your child's condition can change, so repeated checks show whether treatment is working. Because illness changes over time, reassessment tells the nurse whether the plan is helping, failing, or causing harm. It is the feedback loop that keeps care honest. Question 19. Which priority framework best applies to chewable medication warning? Option A. Alphabetical order of tasks. Option B. The easiest task first every time. Option C. Airway, breathing, circulation, safety, then targeted pediatric needs. Option D. The task requested by the loudest person. The correct answer is option C. Airway, breathing, circulation, safety, then targeted pediatric needs. Because priorities must protect life before routine comfort, the nurse uses a framework that keeps decisions disciplined. ABCs are not just letters, they are the order of survival. Question 20. Which family comment should the nurse address during liquid medication measurement care? Option A. We want to understand the warning signs. Option B. We will help track follow-up appointments. Option C. We will call if the nurse told us it is urgent. Option D. We thought new severe symptoms could wait until tomorrow. The correct answer is option D. We thought new severe symptoms could wait until tomorrow. Because family beliefs shape what happens after discharge, the nurse corrects dangerous delays. Teaching the family is like placing a second safety monitor at home. Question 21. Which action shows patient advocacy during parent medication teaching? Option A. Question unsafe changes and speak up when assessment data show risk. Option B. Stay silent to avoid bothering the team. Option C. Hide abnormal findings to keep the unit calm. Option D. Let confusion continue without assessment. The correct answer is option A. Question unsafe changes and speak up when assessment data show risk. Because advocacy means protecting the child when risk appears, the nurse uses evidence and communication to keep care safe. Speaking up is not conflict, it is professional courage. Question 22. Which infection prevention step matters in medication refusal care? Option A. Skip hand hygiene when the child looks clean. Option B. Use hand hygiene, appropriate precautions, clean equipment, and caregiver education. Option C. Share supplies between rooms without cleaning. Option D. Ignore isolation instructions to save time. The correct answer is option B. Use hand hygiene, appropriate precautions, clean equipment, and caregiver education. Because infection can turn recovery into a setback, prevention must be routine and deliberate. Clean practice is one of the quietest ways nurses save lives. Question 23. Which sign would support calling rapid response during nebulized medication teaching? Option A. A request for a second blanket. Option B. A preference for a different snack. Option C. Sudden instability in airway, breathing, circulation, mental status, or perfusion. Option D. A routine question about visiting hours. The correct answer is option C, sudden instability in airway, breathing, circulation, mental status, or perfusion. Because rapid response is designed to bring help before collapse, the nurse calls when vital systems begin to fail. Early escalation is a mark of skill, not panic. Question 24. Which statement best fits exam preparation for iron supplementation? Option A, choose the longest option every time. Option B, choose the option that delays all intervention. Option C, choose the option that ignores assessment data. Option D, choose the option that protects life first and then addresses the pediatric disease process. The correct answer is option D, choose the option that protects life first and then addresses the pediatric disease process. Because strong exam reasoning mirrors bedside reasoning, the safest answer protects life and uses the disease clues. The secret is not memorizing words, it is seeing the priority behind them. Question 25. What is the best overall nursing mindset for chemotherapy precautions? Option A, stay calm, assess deeply, act early, communicate clearly, and reassess often. Option B, assume the first plan always works. Option C, ignore subtle changes until they become severe. Option D, focus on tasks without thinking about risk. The correct answer is option A, stay calm, assess deeply, act early, communicate clearly, and reassess often. Because pediatric nursing is a balance of watchfulness and action, the nurse must think while moving and reassess after acting. The best nurse is calm enough to notice and brave enough to respond.